The NSAIDs are medications that are used commonly for their antipyretic, analgesic, and anti-inflammatory effect. They act primarily by inhibiting the cyclooxygenase enzymes. Let's take a look at the detailed mechanism of action of NSAIDs. Arachidonic acid is the primary precursor of prostaglandins and related compounds. It is present as a component of the phospholipids of cell membranes and released from tissue phospholipids by the action of phospholipase A2, followed by the stimuli, like tissue injury or irritation. Arachidonic acid is converted to prostaglandin PGH2 through COX-1 and COX-2 enzymes. PGH2 is then converted to PGE2 through prostaglandin isomerase, thromboxane A2 via thromboxane synthase, and prostacyclin PGI2 through prostacyclin synthase. COX-1 is responsible for the physiological production of prostaglandins PGE2, prostacyclin PGI2 and thromboxane A2, whereas COX-2 causes the production of prostaglandins PGE2 and prostacyclin PGI2 in sites of inflammation and chronic disease. COX-1 is a constitutive enzyme that regulates normal cellular processes, such as gastric cytoprotection, kidney functions, platelet aggregation, and vascular homeostasis. COX-2 is responsible for the production of PGE2 in inflammatory state through inflammatory cells. These prostaglandins produce key inflammatory responses such as fever and pain. COX-2 also produce prostacyclin PGI2, which is responsible for vasodilation and inhibition of platelet aggregation. NSAIDs are non-selective that inhibit both COX-1 and COX-2 enzyme and selective COX-2 inhibitors. Inhibition of COX-2 is thought to lead to the anti-inflammatory, antipyretic and analgesic actions of NSAIDs, while inhibition of COX-1 is responsible for prevention of cardiovascular events and most adverse effects, which describe later. Therapeutic uses. The most common adverse effect of NSAIDs is GI-related, where COX-1 enzyme converts arachidonic acid into PGE2 and PGI2. These prostaglandins decreases gastric acid secretion and stimulate the synthesis of protective mucus. Agents that inhibit COX-1 reduce beneficial levels of these prostaglandins, resulting in increased gastric acid secretion, diminished mucus protection, and increased risk for GI bleeding and ulceration. In kidneys, COX-1 enzyme is responsible for the synthesis of prostaglandins PGE2 and PGI2 that maintain the renal blood flow. NSAIDs inhibit the synthesis of these prostaglandins and decrease blood flow to the glomerulus due to the constriction of afferent arterioles. All NSAIDs should be used cautiously, or avoided, in renal failure. Also, NSAIDs decreases the excretion of sodium and water, so it causes edema in some patients, especially in patients with a history of heart failure and kidney diseases, and can also cause hyperkalemia. An increased risk for cardiovascular events, including myocardial infarction and stroke, has been associated with all NSAIDs except aspirin. Under normal condition, there is a balance between prostacyclin PGI2 and thromboxane A2. Prostacyclin PGI2 is produced by COX-2 in endothelial cells and is responsible for vasodilation and inhibition of platelet aggregation. Thromboxane 2 is produced by COX-1 in platelets and is responsible for vasoconstriction and promotion of platelets aggregation. Selective inhibition of COX-2 shifts the balance in favor of thromboxane 2 formation. This makes vasoconstriction and platelets aggregation more likely to occur. This in turn leads to increased risk of cardiovascular events including myocardial infarction and stroke. NSAIDs should be used with caution in patients with asthma, as inhibition of cyclooxygenase pathway can cause a shift toward lipoxygenase pathway and increase leukotriene production. Leukotrienes cause airway smooth muscle constriction and the production of excess mucus and fluid, and, therefore, increase the risk of exacerbations of asthma. NSAIDs inhibits COX-1-mediated thromboxane 2 formation, because thromboxane 2 is responsible for platelet aggregation, so decrease in its formation result in antiplatelet effect and thus increase the risk of bleeding. Drug interactions. Some common NSAIDs and their doses.